Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. Today we want to welcome Dr. Carlos Munoz. He is a family medicine doctor and a former Physician of the Year who has been practicing at Oak Bend Medical Center for over 26 years. Dr. Munoz sees patients from children to seniors, and he believes in preventative medicine focused on care and education. He is also fluent in both English and Spanish, and we all love Dr. Munoz. So welcome, Dr. Munoz. We're glad to have you here.
Thank you so much, Donna. It's a pleasure being here.
You know, Dr. Munoz, I've been diagnosed with type 2 diabetes, as well as many people, and the information is always so overwhelming. Where do I start?
Oh, that's a good question. Oh, you're not kidding. The information, it seems like there's just an overload of info. What do you do? So if you're diagnosed with diabetes, likely you're going to be in front of your doctor and not know what to ask. So, of course, the conversation with doctor and patient usually kind of talks about your lab results and medications, and you kind of walk away with, well, what do I do after this? Do I check my sugars? Do I call a friend? Or what you want to do is, number one, definitely pick your doctor's brain and ask him or her about the medicines. How do you take them? How often? Because the medicines out there for diabetes are completely varied in how you take them. Some may be twice a day, some may be once a week, and they just all vary. You also want to ask the doctor about diet. And sometimes maybe the doctor may not have too much time to talk about a diet. However, getting with a dietitian would really, really help, because that way you can sit down and ask a dietitian, well, I like to eat this, I like to eat that for breakfast. Is that okay to eat? And so sitting down with a dietitian, you can really try to figure out what it is that you're eating that's not good for you, what it is that is good for you. So
You mean the magic pill won't allow me to go eat my cake?
right. Not unless you share it with the doctor.
Okay. I mean, it's confusing.
Yeah, it really is confusing. And but once again, communication is the key. So if you go home and you've got these prescriptions and you've got this meter and you've been told to do this and that, and you don't quite remember what to do, what I tell my patients is give my office a call and just talk to the nurse, and they'll forward me the message, and we'll just kind of sort it out just one at a time. Because a lot of times you need to hear the info maybe a couple of times to kind of remember, because there is so much. But communication is key.
Okay. And so, should I be checking my blood sugar? And how often should I check it?
Well, that's a really good question. What I tell my patients is that, okay, look, let's say if a patient has been diagnosed and their sugar is, let's say it's really high. Let's say it's out of control. Let's say they come in, do a physical, and their sugar is 300, 400. What we're going to do immediately is talk about a diet and start some medicine and start to check the sugars. So in that situation, I would typically have the patient maybe check their sugar 2 or 3 times a day, start treatment, start a diet, and then I'm going to turn around and want to hear about the readings maybe in a week or so. Now, that's a different situation from, let's say, a patient who's had diabetes for 20 years and they're watching their diet, they're taking their medicines, and their sugars may be really well controlled. Let's say their sugars are in the 120s, 130s. I wouldn't want them to prick their finger 2 or 3 times a day. That would just be overkill. Wouldn't give me any new data. Maybe for them, maybe I'd have them check it maybe once or twice a week. Definitely check it if they feel bad. Let's say if they're starting to feel as if their sugar is going low, shaky, hungry, headaches, sweaty. I tell them, in that situation, check your sugar.
So now they've got all these new machines out because your fingers get so sore from sticking them and testing. What do you think about the testing that goes into the arm, and I think you keep it in for a week or so, and you just use your iPhone or something?
Those are super neat. That new technology, this is where our smartphones and technology is catching up to treatments. And so, for example, the Freestyle Libre is the one that looks like a silver dollar on your shoulder. look like a stamp machine. And so you wear one maybe every 10 to 14 days. And what it does is you can just monitor your sugars just by turning on the app and looking at your phone instead of having to prick your finger every time we want to see your glucose. The other machine is the Dexcom 6. And it's kind of like the Freestyle. It gives you what your sugar, you can just look at your phone and see what the sugar reading is every couple minutes. It's fascinating because just by wearing one of these devices, you can actually improve somebody's glucose just by them being able to tell what their glucose is after what they just ate. So you don't have to change the medicines. You just change the glucose monitoring device to one of these new ones, and you've already lowered their glucose. It's amazing. The technology is great. And so if somebody's insurance pays for one of those devices, I would definitely recommend it. Medicare, you've got to be on insulin for them to approve one of these devices. But commercial insurances vary. Some will pay for it, some won't. But I definitely encourage the patients to try to get one of those over a glucometer. Now, you do need a glucometer for the Freestyle or for the Dexcom at first to calibrate. You want to make sure that when you put on the patch or put on the Dexcom device, that the finger stick matches what you're getting on your app. So at first you check it, but then after a day or so, you don't have to worry about that. I love those new devices. They're great.
And it sounds like it'd help you keep a better diet and know what to eat and kind of navigate through it a little bit better. So, what is a high blood sugar? What is a good reading? Like normal fasting blood sugar, and what's considered postprandial or after 2 hours after a meal, good blood sugar?
Okay. So when you are fasting, let's say you wake up, haven't eaten anything, and if you're diabetic, you want to keep your glucose under 120. Now, compare that to somebody who doesn't have diabetes, and their glucose would be less than 100. So, and with diabetes, a lot of times they're taking medicines, and you don't want to push the glucose too much. You don't want to lower it too much and get hypoglycemic with the medication. So, less than 120 would be acceptable fasting. Now, yes, there's another way to check your glucose to see what your progress is. So, if you eat and then exactly 2 hours later check your glucose, it should be less than 140. So, let's say you've gone out to lunch and 2 hours later you check it and it's 250. Well, you just had too much food. It's then time to diet. So let's say if you check it 2 hours later and it's 120, you know you've done well.
That's good to know because it's all about carbohydrates and proteins and balancing and quantity.
Oh, yeah. Yeah. So small portions when you eat. If you eat small portions and balance what you eat in terms of carbohydrates, protein, and fat, you can keep your glucose lower. You know, some people will really start to cut down on carbs, carbohydrates, and really help control the glucose. You know, you go out to eat and you've got some meat, cut out the breads, cut out the starchy foods, and maybe just a small salad, a little bit of meat, and probably do really well with that.
Right. And exercise plays a part in this, doesn't it? That dreaded word.
Oh, I know, right? Especially when it's 30 degrees outside. But yes, you want to exercise and keep your muscles in shape because when muscles are in shape, they're burning glucose when you're not doing very much. So as opposed to lack of exercise, sedentary lifestyle, you're not going to burn as many calories. So yes, yeah, keep up your exercise and walking every day, 20, 30 minutes would be ideal. You don't have to, start to run miles or anything like that or pump weights, but just walking is fine.
And that would also help us with circulation, which is kind of a secondary problem to diabetes and all of those things, correct?
Oh yeah, that's a big concern with diabetes is the circulatory effects of having high glucose. Of course, the high glucose can combine with cholesterol, and you can have blockages in arteries, and typically it starts in the small arteries down in the feet. For example, the little tiny arteries are the ones that first get clogged and lead to peripheral vascular disease. You know, you'll get that before the arteries in the heart. Typically, you want to exercise, diet, and keep the cholesterol nice and low to help prevent that.
So, as we were preparing to do this podcast and talk about this, because, I hear a lot of people all the time, I have diabetes, what am I going to do? And as I'm watching TV, there are so many commercials about new meds for diabetes and Used to you either on a pill or insulin. I'm really dating myself. And now there's just so many options, and some of them are injections. Can you kind of explain how you even figure all that out?
I know there's so many options now. And you know what? As a doctor, I love it because, yeah, when I was in training, we had metformin, we had glipizide, and we had insulin. We had NPH insulin and regular. That was it. And then I guess towards the end of my residency, they had a new medicine come out, a tablet come out. And that one didn't work out so well. But then different kinds of tablets came out. And then different kinds of insulins came out. And so now I've got these amazing tools to help people with their glucose. And you know what? A lot of these medicines, the side effect is weight loss. I mean, it's amazing. The old diabetes medicines, the glipizides, those kind of meds, yes, they would lower your glucose, but you know what? You start to gain weight with them. Insulin, same thing, you gain weight. Some of these meds that are injectables are once a week and you don't feel it. It doesn't hurt, takes away your appetite, lowers your glucose, and you just get healthier. People actually come into the office actually asking for these once a week injections. They belong to a family called the GLP-1 injections, and GLP-1 is just letters for enzyme that we have, a protein that we have that tells your brain you're full. So when you've eaten a big meal, and they always tell you to eat slow, that way you feel full. Well, the signal to the brain that tells you that you're full is GLP-1. So these injections, if you inject GLP-1 into your body, well, you walk around feeling full, and it's amazing. They've actually kind of rewrapped these diabetic meds into weight loss meds. And they work. I mean, they work great on people who are not diabetic for weight loss. The only hitch is that they're not generic and they're pricey. But for diabetics, it's a little bit easier to get these meds covered either by Medicare or with commercial insurance. They still tend to be more pricey since they are newer, but they work. They're so much different from the previous meds. And there are some new tablets too. The tablets also, they lower the glucose. The newer ones that I'm thinking about, for example, Jardiance, Farxiga, and I'm not paid by these people. These are just tools that I use in the office for my patients. They help lower the glucose by basically rerouting the glucose from the blood to the urine and out your body. And so instead of keeping calories in your body, the calories are just going out of your body, and over time you start to lose weight. They also have other effects too that turn out to be pretty helpful in terms of other diseases. A couple of these meds help treat heart failure. Jardiance and Farxiga in particular, they help you get rid of extra fluid and helps the heart out. That's actually something the cardiologists are using for heart failure without diabetes. It's interesting how these new meds they're working. I really like having all these different tools. As opposed to before, it was either metformin, glipizide, or you're not controlled, here's some insulin.
Yeah, and if you weren't real compliant, it wouldn't be a very good outcome. I really want to discuss with you because I think sometimes people diagnosed with diabetes, some people, not all, but we tend to take it very lightly. I've got medicine. I feel secure. I'm on the borderline of okay, blood sugars. But there's a lot of disease process that can come out of diabetes, like your kidneys, your extremities, your eyes, your circulation. You want to explain the importance of maybe why it's so important? I think people think, well, the doctor just wants me to come back to make money, but it's important that they stay in touch with their physician in order to prevent the disease process. Is that correct?
That's very true. And one of the most common problems with diabetes is, for example, kidney disease. Kidney disease can sneak up on you when you're diabetic. You can start to have the disease where it's called diabetic nephropathy, where you have damage to the tiny little arteries in your kidneys. And what can happen is you can start to have that process going on. And even though your blood shows normal kidney function, the urine starts to show extra protein in the urine just from the damage being done to the kidneys. And, it's something you don't really feel. So what can happen is if you've got this background of damage to the kidneys, well, let's say something big comes up. Let's say you get pneumonia or, oh God, maybe COVID. Let's say you've got some damage to the kidneys in the background and all of a sudden you've got this big infection. Well, if you don't get proper circulation of the kidneys, well, then you can really run into trouble. So you want to, yeah, you may feel fine and you may feel secure, but it's important to really keep your glucose down so that you don't have this ongoing damage to the organs like your heart, your kidneys, the arteries in the feet, your eyes. And speaking about diabetes in the eyes, it's interesting. We talk about damage to the arteries in the feet and the kidneys, and basically it leads to clogged tiny arteries. But in the eyes, it's a little bit different. The ocular effects, what happens to the eyes is that the diabetes promotes or provokes little tiny veins or arteries in the back of the eyes to start growing. And so these little blood vessels, they grow, and you might think that's okay. But what happens is that these aren't normal blood vessels. They start to grow, and then it can actually rupture, or they can start to leak blood into the eye. And so if that happens, well, then you have, you start losing your vision in that particular eye. And there are treatments for it, but really the main treatment is to help prevent it, to keep the glucose low and to keep it from even developing in the first place. There's a lot of effects from diabetes that you don't feel that really become pronounced if something big happens. So it's best just to keep your glucose down. What I mean by that is following your hemoglobin A1C level. That's the diabetic test that doctors use to track your progress. It tells you what your average glucose has been for the last 90 days. And so let's say somebody without the hemoglobin A1C should be 5.7 or less, which translates to an average sugar of about 110. So with diabetes, the goal is to, if you follow American Diabetes Association, they say 7.0 or less. American Association of Endocrinologists, they say 6.5 or less. So if you keep your sugar 135 or less, your chances of developing diabetic complications are less than somebody, let's say, who has a high hemoglobin A1C.
Okay. So it's important because that's what the doctors are looking for when we come in and see them. Trust me, they've got a lot of patients, but they want you here because you are partnered with them. It's very important that you keep up with your appointments. It helps them keep you healthy. Dr. Munoz, is there anything else you want to tell us that we need to know?
Wow. Yeah, definitely. Yes, see your physician, because sometimes things happen that you don't really know are going on. So I would just continue to see if you're diabetic, you want to see your doctor every 90 days to have your blood drawn.
And Dr. Munoz, you're taking new patients and ready to help people conquer the diabetic world, plus any other medical issues that come about?
Yes, of course I am. Definitely, I am.
Dr. Munoz is a great physician that's been in our community for a very long time. He has a very passion for his patients. I suggest if you're having some problems and need to see someone, Dr. Munoz is the one to see. He's a great physician. Dr. Munoz, I want to thank
Oh,
you for joining
thanks,
us
Donna.
today and love to have you back on more conversations of this because I think this is a subject where we get lost most of the time. But a big thank you also to our listeners for tuning in. And beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.